So welcome, my name is Julia. I use she, her pronouns, and I live on Wabanaki land. A quick visual description is that I'm a Palestinian American with short brown hair, a beige headband, clear glasses, and a purple shirt. My background is the Palestinian flag with the Centering Palestine logo on it. We've got that packet link in the chat. Go ahead and open it up. It has all of our links, and then that way you don't have to worry about Zoom, eating the links or losing track of anything. This event is organized by many different volunteers, including Palestinian, Jewish, and ally contributors. I'm going to briefly go over our community agreements, and then we'll do our news update. We do put a content warning on the news update and pause Zoom admittance just for that segment. So if you ever come a few minutes late and get stuck in the waiting room, it's probably just that we're doing the short news segment and you'll be let in just a couple minutes. So let's go over those agreements. This is the short version. You're welcome to view the longer version on that Google Doc that is probably how you got here. So we are a COVID cautious group. This event is organized by COVID cautious folks, and we ask that participants be respectful of that intersection. What that means is that we don't discuss organizing or protesting in ways that don't take really important accessibility measures like COVID precautions. We are, of course, pro-Palestine and support the liberation of Palestine. We are anti-Zionist, and we do not tolerate anti-Semitism or Islamophobia of any kind. We are anti-Zionist, and anti-Zionism is not anti-Semitism. Zionism is a settler colonial nationalist movement. Geopolitical powers like the US and Israeli governments have tried to make Zionism and Jewishness synonymous. This is inaccurate and only serves to further harm Jewish and Palestinian communities. We center marginalized voices, particularly Palestinians right now. We use content warnings when appropriate, and we welcome conversation in the chat. We just ask that it stays on topic, so questions about what we're doing or adding to what we are talking about at the present moment. With that, let's put our content warning in place. This is for news updates, so we are going to be talking about things like casualties, occupation, oppression. If you want to turn your volume down in your computer, you're welcome to do that. We actually put in the chat when the content warning is lifted, so that way you can see and know to put your volume back on. The news segment particularly is not geared toward children, so if you have young ones in earshot, definitely put on some headphones. Okay, so let's get into it. We have a lot of awesome items to do in our action section and great information in our education section, so I'm not going to take too long on the news, but there are some things that we wanted to catch up on. So today is day 235, and at least 36,615 Palestinians have been killed since October. The actual number is likely 10,000 to 15,000 higher than that. Our next topic, Rafah. The scenes in Rafah over this last week have been unbelievably horrific. Dozens have been killed in attacks on refugee camps as Israeli forces set the camps and the folks there on fire. This happened inside a supposedly designated safe zone. Al Jazeera, one of the links included there, Al Jazeera shared a report of a family that has been displaced 8 times in the last 7 months. It's also been reported that that main hospital in Rafah has been shut down as these attacks continue, despite the ICJ ruling telling them to withdraw. Truly, some of the images and videos coming out of Gaza right now are even more horrific than we thought were possible. And we're definitely going to be focusing on that in our how to support folks in Rafah in our action section. I wanted to include a West Bank update. The folks there continue to face increasing violence, including settler attacks, their houses being destroyed, infrastructure continues to be purposefully dismantled. You can catch up on that information there. A little bit of better news. Just this week, Ireland, Norway, and Spain have recognized Palestine as an independent state. That means that now 146 out of 193 UN members recognize Palestine. I just was talking about the ICJ ruling. So with the ICC's recent arrest warrants that we mentioned last week and the ICJ ruling on Rafah, it does represent important movement forward, but concrete action is not really happening yet. So we'll definitely keep you updated as there are more concrete things to share, and we're hoping in a couple weeks that we'll be able to do a deeper dive. I've got some updates next on Sudan. Sudan faces just absolute turmoil as UN experts warn risks of genocide, especially with famine. And the RSF, just this past week, are attempting to seize control of the capital of North Darfur. This has resulted in over 123 deaths and more than 900 injuries. It's really brutal, and it's really important that Americans and our elected officials know that we don't stand for genocide anywhere. The next topic, topic 7, I'm doing a short roundup this week. I've included a link that reminds us to keep talking about Uyghurs and the ethnic cleansing and oppression that they face. There's a great youth initiative. They have an awesome Instagram account. I would definitely recommend catching up there if you haven't. I was determined to include a little bit of positive news, as hard as it can be to find sometimes. So the 2 links there, one is that California State University in Sacramento became the first public university in California to divest from Israel and meet all of their students' demands. This is really cool and rare to see an encampment result where they get all the demands met. That's super awesome. Also, Canada has announced that it will increase the number of visas offered to Palestinians seeking to join family in Canada. So this is a stopgap measure, right? This is not the ideal scenario by any means, but it is definitely life-saving when that visa can really mean the difference between life and death. So I'm glad to see that Canada is expanding that. The last article that I just wanted to flag is an article called Campus Protest Crackdowns Claim to be about anti-Semitism, but they're part of a right-wing plan. This is a really good article to read. I figured our group might be interested in it, but I also think it's a good good article and topic to share that kind of dispels harmful misinformation. So I wanted to include that in the end, less of a news item, more as an explainer, but a cool thing to just be aware of. With that, let's end our content warning. I'm going to let some folks in. Welcome, everyone. We are about to jump into our action section. So we change it up a little bit every week, try and keep it interesting. For today, we're actually going to stay in one big group here together instead of breakout rooms. And yes, totally shout out to that California's SJP branch there. They did incredible work. That's awesome. We're going to hop into our education segment. Really happy that we can devote the time to talk about this tonight. We unfortunately, we could go on forever talking about these things. We're trying not to. We do have a lot of awesome links and information that I definitely recommend you come back to during the week and explore further. So let's dive in. So here's just my little introduction slide that we put together. I really like this quote. A disability justice framework understands that all bodies are unique and essential, and that all bodies have strengths and needs that must be met. That's Patty Byrne. I'm going to jump to this paragraph here for a reason. So you may know, you may not know, Patty Byrne is a really important and one of many important movement shaping disabled activists of color. You can learn more from these resources. This is an article, What is Disability Justice? Since Invalid, the site is down. It is such a great resource. I'm hoping that they will fix it. Sometimes this happens with websites, the internet, but I just did want to clarify why there's a link that isn't working. It's the correct link. We are just hoping that they fix it soon. It happens. So that is just my little note about that link. The reason we're talking about this in relation to Palestine is that throughout Occupy Palestine, so much of the population has been disabled by decades of ethnic cleansing, and routinely their basic needs and human rights are being ignored. So disability justice, as we're going to explore tonight, intersects with all areas of oppression. So this intersection is not only way too often, I don't have to tell y'all, but it's not only too often ignored in general, but especially when we talk about Palestinians. I did want to put a language note before moving on. So many disabled folks use identity first language, particularly in the West. Because of and between translations from Arabic, using mainstream media and international publications, there are going to be some articles linked here that reference or use person first language. The purpose of these is to highlight information and statistics of sharing these resources, never at all to invalidate anyone's identity. So I just wanted to put that language note in there. I put these next two slides in mostly for a reference. This is based on the Citizens and Valid Disability Justice Framework that you may have seen that we've linked in the previous slide. And I can't unfortunately take the time to go through all of it right now, but I encourage you to come back. What I've done on the left of this table is listed out the core principles, and then on the right I've put how that is showing up in Palestine and activism for Palestine. So for example, we'll just look at the first one. So intersectionality, emphasize the importance of considering multiple intersecting identities in disability justice. So for the example, some of these intersections include limited access to healthcare, men being dehumanized, disabled folks not having access to care or aids, the West using pinkwashing to justify violence, etc. Right? So we can see how just in one spot, in one location, there are so many intersections. So I wanted this in here as a reference. It is lengthy, so I'm not going to go over it, but we do have these two slides you can come back to, especially if there's a particular principle that interests you or you want to learn more about. Here's our next section. So this is just some statistics and framing we wanted to mention. So before the current siege on Gaza, it was estimated that approximately 7% of the population in Gaza was disabled. This may be an undercount, as physical disabilities constituted the majority of noted disabilities, whereas disability from psychological trauma was likely already rampant before October. However, disability must also be understood through environmental and social components. This is a great, on the right here, just a quick visual description. We have an Instagram post with an orange background. There's an eye illustration that's the color of the Palestinian flags, and it says, I'm just going to read the text for everyone. Everyone in Gaza is disabled. It's not just the wounded, cancer patients, and women in childbirth. It's children with braces that can't be adjusted. It's contact wearers with no saline. It's airstrike shattered glasses with no optometrist. It's asthma sufferers lacking nebulizers and inhalers. It's diabetics grappling for insulin and glucose monitors. It's people with chronic illnesses who need regular treatment. It's women with endometriosis and even debilitating period cramps. It's the deaf yearning for hearing aids. It's people navigating mental health with no support. So that really just begins to capture what Gazans and what disabled Gazans are going through right now. We did also want to put a note about disability in diaspora, not just within occupied Palestine. So it is not just Palestinians living under direct Israeli control who are disabled by the environment and social conditions of Israeli occupation, apartheid, and genocide. There's this wonderful quote from Leah Lakshmi Penza Simarisha. I'm so sorry, I said that name terribly. No points for me, but she has this beautiful quote. Everyone in Palestinian diaspora is also disabled. From the CPTSD and overwhelming stress of watching a genocide in progress and the grief of losing countless family members. Organizing protests every day, and it is not being enough, and trying to save your loved ones and families. Palestinians in diaspora are literally dying of heart attacks after living with the panic from not being able to reach their families for days. So it's an incredibly stressful time for Palestinians in diaspora. For your Arab and Muslim friends, I definitely recommend that you check in on them when you're able, because it is a really, really scary time. Let me make sure. I think I'm reading this slide and then I'm switching to you, Kevin. Okay, just wanted to make sure I was on track here. So we wanted to include some personal accounts. So the first link is Disability Under Siege, and I have just taken their little blurb, and it says, this is a multidisciplinary project running from 2020 to 2024, which seeks to transform the education provision for children with disabilities in conflict-affected states, specifically Palestine, so Gaza and the West Bank, Lebanon, and Jordan. So if you check out their website, they have it really nicely laid out where they have a lot of like very personal and heartbreaking accounts from kids and adults in Palestine and in other places. I definitely recommend checking that out if that interests you. They have really laid it out very nicely. This next item, we're going to be pulling a lot from this report. It is a lengthy report, but it is fairly, in terms of readability, it is fairly accessible, if that makes sense. So it is not super academic-y language that's hard to understand. It is long, but there's a lot of good information there. So this report, Healthcare Impacts and Inequalities on People with Disabilities, specifically in Gaza, it is a report that monitors violations and also conducts legal analysis. Again, documenting that proof, saying that this is illegal, this is breaking human rights, this should not be happening, right? So you can read that full report or browse that full report. I just wanted to include a short firsthand account. So this is from a father. He says, "We fled quickly from the bombing without taking any food, assistive devices, or the special medications that my children with disabilities need." Sorry, I cut off the last word there. So it just has a lot of examples in the past 4 years, even before October, of how the ongoing genocide and what Palestinians face. It makes disabled Palestinian lives even more dangerous and difficult than usual, which is just heartbreaking to see. So we're going to dive more into the report on the next slide. I'm going to switch. I'm going to pass the baton to Kevin so that you get to hear from somebody else. Let me spotlight you, and I think we said I'll keep the slides going, but let me spotlight you so Zoom. There we go. You're good now.
Okay, great. So hi everybody, I am Kevin. I go by he or they pronouns, and I am calling from Muskogeland. A quick visual description of me is, let's see, I am wearing a white shirt and a blue and white hat. I'm white, Ashkenazi, and mixed, mostly British Isles. I have dark brown hair and dark brown beard and glasses. And let's see, sorry, before we launch into this, I think I just saw a question in the chat about disability-led, Palestinian-led initiatives that center disability justice in Palestine. Oh, okay, great. It was actually already answered by Julia. Thanks for that. That we have some resources at the end. All right, so continuing on, this is a little bit more from that report. If you are able to access the report, it is long, but it's fairly well bookmarked, which makes navigating it easier. And there are actually several accounts throughout the report about stories of living with disability in occupation. In terms of broader themes from that report, I'll just highlight a few here that we put into the slide. So one of the first themes, which I don't think will be a surprise really for anybody here, is that facilities providing services for people with disabilities have been targeted by Israel. It also appears that Israel has intentionally targeted people with disabilities when firing on protesters and civilians as well. A lot of this is talking about like the Great March of Return. And obviously now just the level of attacks and assault has skyrocketed up even so much more than what it was when this report was first worked on. Another thing to note is that the incidence of disability after injury is elevated among Palestinians, specifically because Israel limits the availability of specialized medical services in Palestine and limits the ability of Palestinians to travel abroad for more specialized treatment. Access to assistive technology and electricity for health needs is also restricted by Israel. This is in violation of international human rights and humanitarian law. So, among other things, to make this a little bit more concrete, this means that oxygen therapy machines cannot work consistently, electric wheelchairs cannot charge, and people develop pressure ulcers because they can't charge medical mattresses. And all this is also occurring in the context of a healthcare sector that has been dismantled, so people can't access needed supports, things like, insulin, ongoing medications. And this is also all occurring in a context where there is nowhere safe that anyone can go, and there aren't shelters that are designed to accessibly accommodate thousands of displaced people. And we can go to the next slide. Okay, so then we will share one other quotation from this report. At the top of this slide here, it says Cloudberry Report. That's the nonprofit organization that put this report together. And the quotation is, there are no longer any healthcare institutions providing specialized services for persons with disabilities, whose numbers are escalating daily due to the ongoing aggression. The institutions in Gaza do not adequately address the needs of persons with disabilities, such as providing assistive devices like prosthetics, wheelchairs, air mattresses, nutritional supplements, medical supplies, and rehabilitation. Furthermore, severe psychological distress, particularly following amputation, necessitates long-term psychological and functional rehabilitation, which is currently unavailable. And again, we have to remember this is all occurring because of the context of apartheid and occupation. And we can go to the next one, I think. Okay, so a few slides ago, Julia talked a little bit about intersectionality in terms of disability justice. Intersectionality, it's a concept that actually has a lot of different implications. Many people may think of Kimberly Crenshaw when they think of intersectionality. And I think in the United States, at least, there is a tendency to look at intersectionality in more of like an individual context, like, what systems of oppression does this one particular individual experience? And in a few slides, we're going to be talking, even more about this notion that sometimes we have to look at intersectionality in terms of movements as a whole. So this slide is a little bit of a lead up to that. We'll just go into this slide. There is a myth that Israel has the most moral army, even though that army right now is disabling, disenfranchising, and traumatizing Palestinians on a mass scale. And this means that disabling, attacking, and dehumanizing Palestinians is now repackaged as not just normal, but moral. This erases or disables all Palestinians, and it increases risk for Palestinians with mobility, sensory, learning, psychological, or medical disabilities, which now affects most likely everybody in Gaza. Palestinians with physical, sensory, or medical disabilities also live with the double horror of experiencing genocide and knowledge that they cannot safely access evacuation or necessary life-sustaining treatment. The quote-unquote most moral army also brings out the issue of disability caused by wars and exposure to political violence, and not only biological predispositions or socioeconomic and environmental factors which can produce disability. Disability due to war continues to be understudied and requires more attention from researchers and policymakers alike. This is so especially that in the Palestinian context and elsewhere, political violence not only kills people, but produces disability, sometimes deliberately. And we can go to the next. Okay, so in terms of COVID in Palestine, this slide is just the Cliff Notes version. The next two slides have some quotations that you can read through at your leisure. The Cliff Notes version in terms of COVID in Palestine is that prevention was prioritized very early on in Gaza. The healthcare system had limited capacity to treat a large influx of patients after years of Israeli siege. So quarantine and isolation for people entering Gaza and those who had been in contact with them was implemented. Social distancing was also implemented by closing schools and mosques, and food aid programs switched to making home deliveries so as to reduce risk. Gaza was able to hold off on having a COVID outbreak until August of 2020. The economic impact of COVID, though, was very harsh on Gaza. Electricity outages impacted remote learning and work, and more Gazans were noted to be struggling with mental health and social problems after COVID. And this also occurred in a context where social services were already starved for funds before COVID. In this context, Israel also limited vaccination for Palestinians, which was critiqued by human rights organizations. In terms of now, even though worldwide surveillance of COVID has effectively been dismantled, there would be no way to monitor COVID in Gaza while it is under fire. I think we can assume that there probably is COVID transmission occurring in Gaza right now. We can go on to the next slide, which this is again here for reference. And the next slide is also here for reference. Okay, and yeah, this. All right, so this is what I was starting to get at with the previous slide, intersectionality and liberation. So, I think oftentimes there's a tendency to think of intersectionality in terms of, what different marginalized identities does this person have or not have, or, privileged identities does this person have or not have. And sometimes we do also have to think of intersectionality in terms of larger groups and issues and causes and struggles. This quotation, I believe, is also from Leah. I'm blanking on her last name. Sorry about that. But the person who Julia referenced before on disability justice, and if it's not from that person, then I believe it's from Alice Wong. I'm pretty sure it's from one of those two people. Both of them are very active in disability justice. The quotation is, wherever and however you are entering this time of terror, war, and genocide, your experiences as a disabled person can tell you intuitively that what is happening to the Palestinian people is unacceptable. This is why the worldwide cause for an immediate, long-lasting ceasefire is our cause too. So the causes are intermeshed. Solidarity isn't transactional or conditional. We need to build relationships and show up for other movements because that's a way to build power, and it's just the right thing to do. In terms of looking more nitty-gritty on the ground, what the collision of different causes and activism can look like, I think this last quotation really does a great job of highlighting this. Some disabled friends and I noticed many posts do not contain alt text or captions in videos, so we began to add them because everyone should have access to information about what is happening. My comrade, Sarah Blahovic, created the hashtag alt text Palestine in an effort to encourage everyone to help make content accessible and a toolkit for anyone who wants to get involved. This is collective access and community care.